RSI Causes and Treatment. A repetitive strain injury, or RSI, is the result of any repetitive process that physically stresses the various body parts of the human anatomy. The most often affected structures are muscles, tendons, and nerves. While repetitive stress injuries may occur to any area of the body that is repetitively stressed, the most often affected areas are the neck and upper limbs, often specifically referred to as upper limb disorder. This includes the following body parts: neck and cervical spine, fingers, hands, wrist, elbow, forearm, and shoulder. While the symptoms will specifically be related to the area strained and the severity of the injury, some general symptoms would include any of the following: pain or discomfort that initially occurs during the repetitive action and subsides during rest. Over time, pain may progress in frequency and intensity if the causative action is continued and injury is left untreated. Mild to severe range of motion limitations, decrease to loss of sensation, numbness, or tingling. Decrease to loss of mobility, tenderness over affected area, and swelling over the affected area. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew herbal ice on your affected area to reduce redness, swelling, and inflammation, while dispersing accumulated blood and fluids to help restore normal circulation to the area. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your affected area with acute sinew liniments to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your affected area with chronic sinew liniments to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your affected area to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. Soak your affected area with the sinew relaxing soak to relax muscles and tendons that are in spasm, ease joint pain and stiffness, and improve range of motion. The sinew relaxing soak is particularly useful if you feel restricted mobility in your affected area. The soak is used by immersing the area with the soak in a pot of water or saturating a towel in the liquid and applying it to the area. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.